All right, let's talk about how to lower your set point surgically. This is going to be a relatively brief video that just touches on weight loss surgery, and then we have entire courses really dedicated to the nuts and bolts of how these surgeries work and how to make the right decision about whether this is the right thing for you, and if so, which surgery to have and how to go about the whole process. So weight loss surgery is an incredibly powerful set point lowering therapy. And this is really where all the science started about this idea of your set point. And what we initially thought was weight loss surgery blocks you from eating or prevents you from absorbing calories. But as we started to dive into the science of this, we recognized that that probably wasn't the primary mechanism. And what we really were seeing was this hormonal shift to a lower body weight. And that's what drove the weight loss without the hunger, with the faster metabolism, and really the effortless weight loss that occurs in the first 6 months up to 2 years after surgery. Weight loss surgery has excellent durability. There certainly is the opportunity or possibility that you gain weight back afterward, but the vast majority of patients are able to maintain a significantly lower weight for a long period of time after surgery. Far more likely than losing it through nutrition or exercise or medications. But this is a major life decision, having weight loss surgery. It's extremely invasive. We're changing your anatomy in some circumstances in an irreversible way. And because of this, it's something that is really not for everyone. And I like to make sure that my patients are very educated about the whole process and really understand what they're getting into, and to make sure that we've absolutely maxed out nutrition and exercise attempts at weight loss, and that we come to realize that really this is the only realistic way that we can help someone lose a significant amount of weight and keep it off. And again, weight loss surgery should only be used in conjunction with nutritional change and with an exercise program. It is not a magical cure-all, and it will not solve all of your problems. But it is an incredible tool that we have, and I think for patients who've struggled with a significant amount of obesity for a long period of time and have been unable to make any headway despite really trying with everything that they can, that this is a realistic option that should be considered. So again, the science of your set point really came from weight loss surgery. So let's take the patient who's 300 pounds, and at that point in time, their set point is right at 300. And so as they drift down 5, 10, 15, up to that 10% mark that we've discussed earlier, then eventually the hunger sets in, the metabolism slows down, and the weight loss stops. And this patient very much is stuck in the 270 to 300 pound range. And there's not much that can be done to push things beyond that. But if we do weight loss surgery, we may drop that set point weight to 200 pounds. And really, within days of surgery, your brain has rewired itself, and it now says, wait a second, I'm not 300 pounds, I'm 200 pounds. And look at what's going on here. Now, all of a sudden, if you're at 200 pounds and your body weight is up here at 300, you are on this overfed side of your thermostat. And what happens is when you're on that overfed side, your brain works to help your body lose weight on its own. This is weight loss with your physiology, rather than weight loss that fights your physiology like we see through typical starvation or calorie restriction diets. So when you're on the overfed side, you have decreased hunger and an increased metabolism. This is what we want to help us lose weight. You're not hungry, you're burning a lot of calories, and the weight just really falls off without significant effort. And that's the holy grail of weight loss. And surgery does this in a much more powerful way than nutrition, than exercise, or than medications. So there are several surgical options, but realistically in the United States right now, there are only 2 surgical options that I think patients should be considering: the sleeve gastrectomy and the gastric bypass. And they are both excellent surgeries, and they each have their little nuances. In many ways, they're more similar than they are different, but there are nuances with these surgeries, and we'll spend a lot of time kind of trying to figure out which one would be the right one for you if you're going to proceed with weight loss surgery. The duodenal switch and the adjustable gastric banding down here are still done in this country, but really much less so, with very little frequency. I don't perform either of those surgeries, although adjustable gastric banding has shown itself to have a lot of long-term complications, and I manage those almost on a daily basis. So I still deal with gastric bands, but I'm not putting them in. I'm not doing new gastric band surgery. I really think at this point, most of us should not be doing this. It's not the right surgery for 99+% of all patients considering weight loss surgery. Two other options are the mini gastric bypass and the vertical banded gastroplasty, or VBG, sometimes referred to as stomach stapling. The mini gastric bypass is done overseas, but really not much in the United States. Most insurance companies won't cover it. And the VBG really isn't done at all, though there are still some small islands where it is being done, but it probably shouldn't be. So in terms of comparing the gastric bypass to the sleeve gastrectomy, we're going to do a quick overview of the differences between these. We see more weight loss with the gastric bypass compared to the sleeve gastrectomy. Not a huge amount, depending on your body weight, anywhere from say 15 to 25 pounds. I think the more significant advantage when it comes to these surgeries is that the gastric bypass offers a better durability of weight loss than the sleeve gastrectomy. The vast majority of gastric bypass patients are able to maintain their weight loss without too much effort for at least 5 years. After that, if the habits are creeping back, then you will start to see some weight come back on. But you get 5 good years, and in general, I find that weight regain with a gastric bypass is usually, not always, but usually fair. The patient has reverted to their old ways, they're eating a lot of processed foods and sweets and really going back to their old way of eating, and for that reason starts to put on a lot of weight. Where patients, if they really follow our Pound of Cure program and eat healthy and exercise, and you have a gastric bypass, you're generally able to maintain that weight loss for life at this point. Where the sleeve, I find it's not quite as fair. I've had some sleeve patients who are really disciplined and have followed the rules and still managed to gain back some weight over time. And the durability of the sleeve, in my mind, is just not quite as good as what we see with a gastric bypass. With the problems we have with the gastric bypass are really the complications. 5 to 10% of all gastric bypass patients will need a subsequent surgery at some point to treat a complication of a gastric bypass. That really is a substantial amount, and it is something I absolutely do see in my practice, and it really is something I've become familiar with and can manage. Generally, these problems are not major problems. They're not landing you in the ICU. You're not debilitated. You're still able to work. If you do need a surgery, typically we can get people back to work within a week of the event. And it doesn't require a prolonged stay. That's not always true, but the majority of patients, we can get them through whatever is going wrong in a week. It tends not to come back, and it really isn't a terrible experience, but it certainly is not something that anybody wants to happen. We also see iron deficiency. You'll hear a lot of talk about vitamins, and we'll go over those obviously in detail later on. With the gastric bypass, the problem that we see, the deficiency that is likely to cause a medical problem that requires treatment, that makes you feel bad, not just a blood test that shows that something's low, but a problem where you need treatment, you're not feeling well, is iron deficiency. And about 25% of all gastric bypass patients will have some degree of iron deficiency. If you stay on top of it by taking the right types of iron supplements, it really is a very manageable problem. And oftentimes you're replacing 5 or 6 medications that you were taking before surgery with 1 iron tablet. And it's much cheaper and obviously much more preferable to be on iron than 5 medications. We really don't see either of those issues with a sleeve gastrectomy. The rate of reoperation is very small. And the rate of iron deficiency and other vitamin deficiencies is also significantly lower. What we do see with a sleeve gastrectomy is heartburn over time, and it can be progressive and increase as the years go by. There also is a much smaller group of patients who will have persistent vomiting and difficulty swallowing. Those patients oftentimes will have to undergo a revision surgery, usually do a gastric bypass, but that is probably in the 1 to 2% range, not something we see with too much frequency. The heartburn is something that you'll see up to 25, even 50% of all patients after a sleeve gastrectomy complain of and require medication treatment for. Usually it's pretty manageable, but long-term and chronic heartburn after a sleeve, more than 10 or so years, is really an unknown, and there are some questions about the long-term impact of chronic heartburn after a sleeve gastrectomy. We've been doing this surgery with volume for maybe 10, 12 years in this country, compared to the gastric bypass, which is 40, 50 years of history and experience. And so there still, in my mind, is a little bit of uncertainty about the long-term impact of chronic heartburn. On the opposite side, a gastric bypass is the best heartburn surgery there is. If you suffer from chronic heartburn going into the surgery and it doesn't respond to dietary changes, then a gastric bypass is absolutely the best surgery for you. And typically patients will wake up the next morning, not have any more heartburn, and essentially live their life heartburn free from that point forward. So who benefits the most from weight loss surgery? We're going to, again, go into this in much more detail, but I think if you have a strong family history or a genetic cause for your obesity, that's someone, in my mind, who's just, it's going to be really hard to get them to lose weight through nutrition and exercise, especially if other members in your family have not been able to lose weight through changing their nutrition and exercise. If you've had an early onset of obesity since childhood, since early puberty or high school, those patients, I think, also are probably going to require some type of weight loss surgery in order to lose the weight. I also think that patients who have a good diet coming in make a better weight loss surgery patient. When I see someone who comes in and there's a lot of junk food, there's a lot of fast food, there's sugar sweetened beverages, the first thing we need to do is fix that. We need to improve their diet, get them on the right nutritional plan, and then see what happens. And if the weight starts coming off and they're losing a lot of weight, well, then you don't need weight loss surgery. You really just need to change your diet. Weight loss surgery does not preclude the need for changing your diet. And so patients who come in with in general, it doesn't have to be perfect, but a good baseline diet. There's really no fast food. There's not a lot of processed junk food. There's no sugar sweetened beverages. And there is a steady dose of fruits and vegetables and other plants in the diet. Those patients, I think, if they're still not able to lose weight, then weight loss surgery makes a better option in that situation. Because also we don't have to worry about changing the diet long term. They already came in with a reasonable diet. So as long as they maintain that level of diet, or maybe even improve it a little bit more, then we're going to be set for long-term compliance and a good long-term outcome. Probably the single most important criteria about who's going to benefit from surgery is someone who's educated. That's really the essence of all these videos. I want to make sure that everyone out there knows exactly what they're getting into. This should not be a mystery. You should understand all of the risks and the benefits and how this works. We've done millions of these surgeries at this point. We have a ton of experience. We've reduced the complication rate to the 1 to 2% rate for serious complications. We know a lot about this, and so should you if you're making this major life decision. And I think the final point that is helpful but not mandatory is someone with a strong support network. As long as you have family and friends who are there standing by you, really trying to cheer you on and help you through this process, that goes a long way in your recovery and in changing your life and making all these positive changes. I think when you have people in your life who are doing exactly the opposite and kind of rooting against you, or somehow jealous or angry about your decision, that makes this really, really difficult. And we'll discuss this in more detail as we get into some of the emotional issues surrounding weight loss surgery.